For our presentation, we decided to look into health and exercise during pregnancy for our population. Um, we just wanted to start with a table of contents. First, we'll go through kind of an introduction to pregnancy, and then the three clinically relevant health challenges, gestational diabetes, hypertension, and weight gain. And then we'll talk about the benefits of exercise to these challenges, as well as some of the ACSM recommendations for pregnant individuals, and then finish off with some special considerations.
A little bit of an introduction to pregnancy and how it relates specifically to exercise. Although routine exercise seems to improve health during pregnancy, there is some concern that it might interfere with fetal growth and development. Historically, pregnancy was actually a contradiction to exercise, although now it is considered safe for the fetus and the mother. The goal of exercise during pregnancy should not be weight loss. Instead, it should be to develop muscle strength and endurance to alleviate some of the discomforts associated with pregnancy, labor, and delivery. It is important to understand some of the hormonal changes during pregnancy, specifically with these four hormones. Estrogen prepares the uterus for implantation of blastocyte, stimulates uterus growth after implantation, and it continues to rise throughout the 9 months of pregnancy, as you can see on the graph to the upper right. It also increases blood volume by causing the collecting ducts and the kidney tubules to retain more sodium, causing weight gain, specifically by edema. Progesterone maintains the thickened state of the endometrium and increases its secretions, which nourish the developing blastocyte. It also causes headaches, blurred visions, tender breasts, and heartburn, so some of the symptoms that we see common with pregnancy. It also continues to increase throughout the 9 months of pregnancy. Relaxin reduces uterine contractions. However, it also causes joint instability, which is an important thing to remember when prescribing exercise to a pregnant person. Although once the blastocyte implants about 6 to 7 days after fertilization, the embryonic membranes begin to release a hormone called human chronotropic gonadotropin, or HCG. This spikes early in pregnancy to ensure that the corpus luteum continues to release both estrogen and progesterone. It also ensures that the corpus luteum continues to release both estrogen and progesterone. There are 3 trimesters of pregnancy. Each of them is 3 months. The first trimester is characteristic of morning sickness, nausea, and fatigue, leads women to avoid physical activity. However, exercise is known to alleviate some of these symptoms. The second trimester is when the placenta is fully functioning. It produces major hormones and acts as the site of nutrient, oxygen, and waste exchange between the mother and the fetus. This is when the abdomen starts to enlarge as the fetus grows, which can alter the center of balance and often cause back pain, again leading women to avoid some physical activity. This is also when the edema can cause discomfort and begin to increase. The picture on the right shows some of the critical stages during pregnancy and what's developing during those critical stages. And it's important to remember that when performing exercise, some exercise is thought to, or some actions and behaviors by pregnant women can disrupt these critical stages. Finally, the third trimester begins with more pressure on the mother's surrounding organs and structures, including frequent urination and constipation, which will continue to increase throughout this trimester. It's also known for an increased risk of hemorrhoids due to weight gain. Finally, talking about the metabolic demands of pregnancy, the blood volume reaches about 150% at about 36 weeks. The cardiac output also increases by 50% in the first 8 months of pregnancy. So a lot more blood is required to ensure adequate blood supply to the placenta, but it also is known to put a burden on the mother's heart. During the last month of pregnancy, cardiac output often declines by 10 to 30%, but stroke volume remains high to sustain fetal needs. One of the first concern that we're going to talk about with pregnancy is weight gain during pregnancy. Weight gain during pregnancy is normal and considered healthy as long as it remains within the recommended guidelines. An active lifestyle and balanced diet is recommended to maintain healthy weight. Being underweight or obese prior to conception makes it not only harder to conceive, but also leads to an increased risk of complications during pregnancy. This is the Mayo Clinic's guidelines for how much weight should be gained during pregnancy, depending on your BMI prior to becoming pregnant. Birth weight, which is the weight of the baby once it's born, is the strongest predictor of infant health, and birth weight positively correlates with mother's BMI before pregnancy. As BMI increases, so does possible complications, which includes increased risk of gestational diabetes and increased risk of hypertension, which we will talk about later, as well as an increased likelihood of needing a C-section, which can include its own complications, and a higher risk of miscarriage or stillbirth. Underweight females also tend to deliver preterm babies or babies with low body weight, which again contributes to the health of the baby. Obesity doubles the risk of neural tube defects as well as heart abnormalities within the fetus. Continual weight gain negatively affects circulation and continues to promote edema, which will then also lead to more weight gain. Exercise and weight gain during pregnancy. Increasing ex expended energy from exercise helps to moderate weight gain and reduce total body weight during pregnancy. Women who exercise during pregnancy are more likely to continue to exercise and lose postpartum weight more quickly. So not only will they be maintaining a healthy weight and leading to a healthy birth during pregnancy, but they will also be more likely to get back to a similar BMI more quickly after having a baby. It also increases blood volume and cardiac output, therefore improves circulation and helps prevent the painful swelling. So as we saw during the second trimester, as edema begins, it helps to alleviate some of that swelling because of the edema. In relation, it also improves the efficacy of the lymphatic system and helps to bring lymph back to the circulation. Finally, it helps to enhance nutrients and delivery to improve blood and body composition and enhances women's body ability to adapt to anatomical changes that may occur.
Next, we wanted to talk about another clinically relevant challenge, which is gestational diabetes mellitus. While not all, oh no, here. While not all individuals will experience gestational diabetes, it is fairly prevalent in the world today. Gestational diabetes is high blood sugar that develops during pregnancy in individuals who didn't previously have diabetes. This can be caused by pregnancy hormones making the body resistant to insulin, preventing cells from using sugar for energy. This can increase the risk of developing complications during pregnancies, also such as hypertension or C-section delivery, as well as delivering large infants. So we saw that weight gain can lead to gestational diabetes, or if an individual is overweight before getting pregnant, that can also lead to a higher risk of diabetes, and that can cause more complications later. Gestational diabetes is temporary and can be resolved after birth, but it also increases the chances of developing type 2 diabetes when you're not pregnant, as well as diabetes in the infant. Compared to normal healthy populations, individuals with gestational diabetes need to monitor their blood glucose through nutrition, lifestyle changes, exercise, and medications. So while it is beneficial and important to exercise during pregnancy, it becomes extra important for these individuals to make sure they're maintaining that blood glucose to keep both mom and baby healthy. Another is understanding gestational diabetes and optimizing glucose control can help individuals prevent serious complications during birth, as well as improve quality of life for mom and baby during and after pregnancy. Staying active during pregnancy can lower an individual's risk of gestational diabetes by about 40%. Regular physical activity can help maintain fasted and post-meal blood glucose values with um, within target ranges as pregnancy progresses. Following delivery, physical activity reduces the risk of type 2 diabetes by 28%. So this tells us that while it's important to exercise before pregnancy, just in your regular life, it's also important to exercise during pregnancy to avoid complications and postpartum to prevent possible diabetes later in life. Prenatal physical activity also has benefits such as improving mood, reducing fatigue, and preventing high blood pressure. So we've learned a lot about how physical activity can benefit so many aspects of life, and this is just more proof to that.
The next topic that we'll be talking about is hypertension during pregnancy. Hypertension is defined as blood pressure of 140 over 90 or higher, and this is normally measured on two separate occasions and at least 4 hours apart during pregnancy. Hypertension during pregnancy can be caused by a wide variety of things, but one of the most common things is that it's caused by is abnormal placental development. And also, it can be caused by an immune response to the placenta. Hypertension is a major health challenge during pregnancy because it increases the risks for both the mother and the baby. High blood pressure can progress to preeclampsia, which is a very dangerous complication during pregnancy and can cause organ damage in the future. Um, what happens during hypertension is it can cause a reduction in blood flow to the placenta, which can impair the blood supply that delivers oxygen and nutrients to the baby. And also later on, if you do have hypertension during pregnancy, it can raise the risk of future cardiovascular diseases. And compared to a typical healthy adult, pregnant women with hypertension should have more frequent medical checkups. They should be checking their blood pressure at home using their own blood pressure cuffs. They should be modifying their exercise and watch for warning signs of preeclampsia. In terms of hypertension and exercise, there are a lot of benefits. Regular exercise during pregnancy can help prevent or reduce hypertension. First of all, it helps improve blood vessel function. Exercise can increase the endothelial nitric oxide production and release more nitric oxide, which helps blood vessels relax and widen, which reduces the amount of strain from blood being pushed by the blood vessels, and this will lower blood pressure. It can also help with insulin resistance. Poor insulin sensitivity is associated with higher blood pressure, and exercise enhances insulin sensitivity, which can stabilize blood sugar and reduce hypertension risk. It also helps with regulating weight gain, as mentioned earlier, and because excessive weight gain during pregnancy can increase the risk of hypertension, and regular physical activity helps to maintain a healthy weight gain, which can lower cardiovascular strain. There are some risks that with exercise in pregnancy, just because pregnant women need to be watching, especially if they have hypertension, need to be watching their exercise a little bit more. Um, Hypertension makes exercise more challenging for pregnant women because it increases health risks and requires extra caution. For example, because exercise naturally increases blood pressure, pregnant women who already have a higher blood pressure, it is important for them to um, watch what forms of exercise they do, and it's advised for them to avoid high intensity workouts like heavy lifting or any activity that causes a sudden spike in blood pressure. Because of this, it might limit the types of exercises that are safe for them to do, which is why it's important to educate themselves about what is safe for them to do if they do have hypertension. And we have the ACSM recommendations as well. In terms of frequency of exercise, it's important to spread out their exercise throughout the week, and about 150 minutes of exercise per week. It's recommended that there's aerobic exercise most days of the week, like 3 to 5 days, and resistance training 2 to 3 non-consecutive days. In terms of intensity, it's recommended that pregnant women exercise at a moderate intensity, and you should be able to complete the talk test, which is being able to hold a conversation while exercising. In terms of time,
aerobic exercise can be about 20 to 30 minutes per session. And for strength training, it can be 1 to 3 sets for about 8 to 12 repetition per major muscle group. Some recommendations for type of exercise for pregnant women are walking, stationary cycling, yoga, light resistance training, and low impact aerobics. And in terms of special considerations for pregnant women, it's important to try to avoid overheating and stay hydrated and wear supportive clothing, and modify exercises as pregnancy progresses and as their fetus develops. Um, and it's important to stop exercising and seek medical advice if there's vaginal bleeding, dizziness or fainting, chest pain or palpitations, and persistent contractions or fluid leakage.
Some of the physiological benefits of exercise, we've kind of already mentioned them throughout our presentation, but we wanted to just go over them one more time, and I'll just do that really quickly. The first, gestational diabetes. Muscles are more sensitive to insulin and increase glucose uptake post-exercise. So exercise activates enzymes that send signals to move the GLUT4 transporters to the membrane to uptake glucose in the muscle. Also, we see increased blood flow causes insulin and glucose to be delivered up and taken by muscle more quickly. With hypertension, exercise will help lower the resting blood pressure by it will reduce systolic and diastolic blood pressure, improve blood vessel elasticity, decrease resistance in the arteries, and during exercise, the body will release nitric oxide, causing vasodilation or the arteries widening and lower vascular resistance, so resting blood pressure drops. And with body weight gain, exercise will improve circulation to reduce weight gain caused by edema, and exercise can help maintain maternal weight, which is a direct influence on baby's weight and therefore their health. And these are our references. Thank you for listening.
Okay, it was 17.